Alright, I'm going to show you on the chart actually the locations and bodies and structures of the ear that you want to look at when you're looking at the other videos, if you're trying to help yourself or help somebody else, if they have a headache or back pain or anything. Okay, so first off, let's go with the tragus. The tragus is that sticks out right in front of where your ear canal is. That portion right here. Then we have the lobe of the ear, which is down here. Okay, this is where you put your earrings in, of course, or where most commonly the earrings are put in. You have your helix, the outside portion of your ear. This is the root of the helix here, and it goes all the way around the ear. All the way around the ear. Okay? Some earrings can be placed in this as well. Then we have the triangular fossa up here. Triangular fossa. And the cavum concha. The cavum concha, this would be named cavum concha. This is where most of, if not all of the organs are placed. All of the organs like the small intestine, the kidney, the urinary bladder, the heart, the lung, the stomach, and so forth. Now, the antihelix. Antihelix because it's opposite of the helix. You have up here, which is the antihelix, where it's your toes, ankles, knees, hips, lumbar sacral region, all the way down. And your inferior helix, across, all the way down. Of course, antihelix, both of them coming down, connecting into the antitragus. Oops. Which is right here. Antitragus. And antitragus notch. If this is the tragus, here's the antitragus. This was the region which we talked about that was to treat headaches. Okay? The back of the head, the top of the head, the side of the head. And last but not least is your scaphoid fossa. Back of the ear, this is what is used to treat fingers, wrists, elbows, shoulders, and clavicle. Okay? So again, here's your tragus, antitragus, helix, antihelix in the green. Triangular fossa above, this is a lot of calming points in there, also the uterus. So if we're treating infertility or labor induction or cyst, this part of the ear is quite used commonly. Your concha, superior concha, inferior concha, all where the internal organs are, such as your kidney, your stomach, your spleen, your lungs, your heart, so forth. And you have your antitragus here, or antihelix coming down, your scaphoid fossa coming down. Again, the helix is around the whole ear, and then the lobe of the ear as well. Okay? So that's the ear, and a review to some of those other charts that you might be able to help yourself with. Now we have a live ear to demonstrate what we had just talked about on the board. Here's your tragus. Here's the lobe of the ear. This is where the earrings are typically put on. The scaphoid fossa coming up here. This is also where earrings are put in. Here, going around the outside, is the helix. Now, whenever I say anti, it's the opposite. So if this is the tragus here, use this. This is the antitragus notch here. And here is the antihelix. All of this, the inferior body, superior crust, coming down. Okay? And here is the root of the helix connecting into the concha, the superior concha, inferior concha, and also the triangular fossa up here in this region. Now again, just a reminder, the body of a fetus is, the ear is an inverted fetus. So the head is here, legs are up here. This is how we treat. So this would be the neck going up to the thoracic region and down to the lumbar region into the sciatica and gluteal region here. Okay? Your abdominal region in this area and so forth. So head being below, feet being above.